Australian researchers are at the forefront of understanding, preventing and treating neurological conditions.
Their work spans a broad spectrum of approaches and diseases. A major focus is neurodegeneration, which encompasses debilitating conditions like Alzheimer's disease and various dementias, Parkinson's disease, motor neuron disease, Huntington's disease, and progressive supranuclear palsy. Here, research aims to unravel how these diseases progress, discover early diagnostic markers, and develop revolutionary new therapies. Significant effort is also dedicated to mental health. Australian scientists are delving into the neurological foundations of conditions such as schizophrenia, bipolar disorder, depression, and anxiety. This often involves exploring the intricate circuitry of the brain, understanding genetic influences, and pioneering novel treatments, including advanced brain stimulation techniques. Then there's translational neuroscience. This vital area focuses on bringing laboratory breakthroughs into real-world clinical solutions. It includes important work on preventing falls and improving balance, addressing chronic pain and injury, and advanced brain mapping. For epilepsy, researchers are committed to improving diagnostic accuracy, developing new treatment options, including minimally invasive surgery, and identifying the genetic roots of the condition. In multiple sclerosis, or MS, studies are underway to understand disease progression, explore groundbreaking new treatments like stem cell therapies and highly effective medications, and even use mobile technology for ongoing patient monitoring. Stroke research is focused on enhancing rehabilitation outcomes, understanding how the brain repairs itself after an injury, and developing crucial new interventions. Brain injury research covers the long-term effects of traumatic brain injury, alongside vital work in spinal cord injury research and rehabilitation. And importantly, institutions like the Murdoch Children's Research Institute are dedicated to childhood neurological disorders. Their work aims to improve the lives of children with conditions such as cerebral palsy, severe childhood epilepsy, and rare genetic neurological disorders like leukodystrophies. There has been a lot of research into mild brain injury, referred to as concussion, particularly in sport.
For the majority of people that have a mild traumatic brain injury, or otherwise can be referred to as a concussion, they do recover within the first month, so sort of 2 to 4 weeks after their injury, they're back to their normal activities. However, we know that around 30% of people, sometimes some studies quoting up to 50%, these people do have a delayed recovery, and that can be a number of debilitating symptoms that continue for months or even years after an injury. And as you say, just because the word is mild, it doesn't mean that those symptoms are mild, and the hard part is they're often invisible as well, so it's not as obvious that these people might be experiencing a number of challenges. But what our research is trying to do is to better understand the people that recover or have that delayed recovery period. So there's ones who are the predictors of people who are more likely to have a prolonged or delayed recovery, and how we can better understand that to improve recovery, but also get more timely and specific help in those early stages to reduce the chances of those persistent symptoms.
So tell me about the work that you're doing internationally. What sort of projects are you doing?
Our current focus is really about the AusMTBR study is really about Australia-wide. Looking to expand that into different countries in the future, but for now what we're looking to do is use an app to better understand predictors of outcome, and so collecting information from people who have had a concussion, and it's for all sorts of concussions. So concussion obviously is common in sports, but it can be from things like falls or violence and car accidents, things like that as well. And so trying to understand those people who are more likely to have a delayed recovery, and using the app. So with the HeadCheck app is the app, and then our project is sort of an arm, a branch within that. And using that, it's got an inbuilt recovery program, so it offers not only the research, but it actually offers people a graded recovery program to help with their recovery journey. And then it sort of monitors your symptoms as well. So we're asking about your symptoms at different time points after your injury, and giving you that information in a real-time sort of personalised sense to help you continue to get back to your normal activities. So covers things like normal physical activity, so going for a walk or playing sport, as well as returning to study or returning to work. Been developed with the concussion guidelines that have come out, and it's all evidence-based and very thoroughly sort of checked. There's the actual app itself has been around for a number of years, but this is the first time it's been sort of revamped to include a research pathway.
Monash University is a significant hub for research into sexual function after brain injury, particularly traumatic brain injury. Researchers such as Professor Jenny Ponsford have extensively documented the prevalence and types of sexual changes experienced after traumatic brain injury. Examples of their work have shown approximately 36 to 54% of individuals with traumatic brain injury report difficulties with sexuality.
Over many years, Eva, we've been following up people like you who've been through the hospital, who've sustained traumatic brain injury, and asking them about their sexuality, and find that the majority tell us that they experienced negative changes in sexuality, not only that decline in sexual function, but also their sexual well-being, their self-esteem, their body image, their confidence in relationships. And so having done that, we felt it was very important to start addressing this issue from a number of perspectives.
That's really exciting. So it seems like a great hurdle, a great part of the difficulty was actually broaching it with the actual clinicians. So
yeah, a lot of it was, role playing with them. They just felt so nervous about saying the sex word. But that said, although we've achieved it for the time being, we feel that ongoing training and support is going to be needed to sustain that change, because there is still this lingering discomfort. The neuropsychologists have stepped up and they've agreed that they're going to routinely raise sexuality as part of their history taking and discussions with their patients, and we're just hoping that can go forward. But it's going to need to be built into staff education programs to be able to continue it on, and they need a lot of practice. And then the other issue, of course, that they raise is that when patients say that they have a problem, they want to know what to do about it. So the third component, the staff, the clinicians say, well, we're not experts in sex therapy, what do we do? So to that end, we have also, and this was Eleanor Fraser did this as part of her doctoral research, developed a cognitive behaviour therapy intervention that is being evaluated in an ongoing way at Epworth. And that is therapy. It's got 12 different modules. It's very individualised, but it's designed to assess what is important for that particular person, and it might be just a person by themselves or a couple who is undertaking the therapy. Everything from undertaking psychosexual exercises, but also working on communication and self-esteem, self-confidence, all these different components, and we use whichever modules are appropriate.
Monash University, through the Monash Epworth Rehabilitation Research Centre, actively recruits participants for ongoing studies. One of their current research studies, directly related to this topic, is cognitive behaviour therapy for sexuality disturbance after traumatic brain injury. This study aims to evaluate the effectiveness of a holistic CBT program. Participants receive 8 one-on-one therapy sessions with a clinical psychologist. Eligibility typically includes a history of traumatic brain injury, sexuality difficulties resulting from the traumatic brain injury, and being aged between 18 to 65.